What's going on, everybody, and welcome to the Easy Thyroid YouTube channel. Today we are going to be looking at the topic, why do we get thyroid problems? Now, I know when I was diagnosed with hypothyroidism, I was confused. I didn't even know what it was or anything like that. Then on top of that, I wanted to know how did it happen and did I do something. Now, I'm sure if not all of you, but some of you are probably wondering the same thing. So hopefully this video can answer those questions. And I just want to be clear that no one purposely gives themselves thyroid disease. These things are inherited in some cases, right? So I just wanted to clear the air. Now, let's look at a brief definition of thyroid disease. Thyroid disease is a general term for medical conditions that keep your thyroid from making the right amount of hormone. Your thyroid typically makes hormones that keep your body functioning normally. So, what causes thyroid problems? Well, there are a number of factors, and the first factor is thyroiditis. This condition is an inflammation or swelling of the thyroid gland. Your thyroid's ability to generate hormones can be reduced by thyroiditis. Our next condition is Hashimotos thyroiditis. And Hashimotos thyroiditis is a non-painful autoimmune illness in which the thyroid is attacked and harmed by the body's cells. So this illness definitely is inherited. And did you know that 5 to 9% of women experience postpartum thyroiditis after giving birth? Yeah. But however, it only lasts for a short while. Our next condition is lack of iodine. The thyroid needs iodine to make hormones. Around the world, millions of people suffer from iodine shortage. Our next condition is a thyroid that isn't working properly. Sometimes the thyroid gland isn't operating properly from birth. About 1 in 4,000 infants are impacted by this. The baby may have physical or mental problems in the future if left untreated. In the hospital, actually, a screening blood test is administered to all infants to check their thyroid function. So all of the conditions that I just mentioned are factors that can cause hypothyroidism. So conditions that can cause hyperthyroidism are 1. Graves' disease. In this condition, the entire gland may be overactive and produce too much hormone. And this problem is also called diffuse toxic goiter or an enlarged goiter gland. The next condition is nodules. Excessively active thyroid nodules might result in hyperthyroidism. A goiter with many nodules is referred to as a toxic multinodular thyroid nodule, whereas a single one is known as a toxic autonomously functioning thyroid nodule. The next factor that can contribute to hyperthyroidism is excessive iodine. When you have too much iodine in your body, the thyroid makes more thyroid hormones than it needs, and excessive iodine can be found in some medication and cough syrup. So thyroid disease can affect anyone, whether it's an infant or a teen or an adult. However, you are at a higher risk if you have a family history of thyroid disease, or if you have a medical condition, if you're older than 16, and especially if you are a woman. And another thing is if you had any treatment for past thyroid condition, then you may be at risk. So there are questions that people may ask, and that is, does having diabetes increase my risk of acquiring thyroid disease? Compared to persons without diabetes, those who have diabetes have an increased chance of acquiring the thyroid illness. For example, type 1 diabetes is an autoimmune condition, and you are more prone to acquire another autoimmune condition if you already have one. Those who have type 2 diabetes are at lesser risk, although it is still present. So later in age, however, thyroid illness is more likely to strike in person with type 2 diabetes. So it's advised to regularly test for thyroid problems. People with type 1 diabetes may acquire more testing than those with type 2 diabetes, starting right away after the diagnosis and continuing maybe for about a year. Now, if you have diabetes and you get a positive thyroid test, there are a few things you can do to help you feel, the best way as possible, and that includes getting enough rest, exercising regularly, watching your diet, taking your medication as directed, or if you prefer to go the natural route, then I would suggest, talking to a herbalist or a healthcare provider. Also getting tested regularly as directed by your healthcare. Alright guys, I don't want to keep you any longer, so that is it for this video. Remember to like, comment and subscribe. Until next time guys, bye.